How would you feel if you went to the doctor and was told that you had acquired flesh-eating disease at your wound site? All of this could have been prevented if only the nurse had washed her hands before changing the dressing on your wound. Patients in the intensive care unit and clinics are at high risk for acquiring nosocomial infections. This is according to the CDC 2010. There was an estimated 722,000 hospital-acquired infections in the United States. And of that, 75,000 died. More than half of all infections in the hospital that are acquired occur outside of the intensive care unit. This is according to a report in 2010 by the CDC. Research suggests that hand washing decreases nosocomial infections. It also decreases the mortality rate of hospitalized patients, and hand washing will decrease the length of stay of hospitalized patients. Today, I will discuss 2 points regarding my topic. First, hand washing will decrease the mortality rate of hospitalized patients. 2, hand washing is an effective way to decrease nosocomial infections. My first point is that hand washing would decrease the mortality rate of hospitalized patients. This point was made by Cervic in 2006. He noted that hospital-acquired infections are caused by viral, bacterial, and fungal pathogens. The most common types are bloodstream infections, such as pneumonia, surgical site infections, and UTIs. You must understand that hand washing is a simple and effective method for preventing nosocomial infections in the hospital units, according to the report by Cervic in 2006. According to a publication by the CDC, incidences of nosocomial infections are estimated at 2 million cases annually, or about 10% of American hospital patients. Hand washing compliance should not be limited to only care providers. All ancillary staff that have access to the patient area should be required to perform effective hand hygiene. Effective hand washing will lead to a decrease in the presence of life-threatening microorganisms. The goal of decreasing infection will be achieved through compliance and teamwork. The end result of the entire staff being advertent in the hand washing efforts will be less mortality. Some hospitals and healthcare facilities have cleanliness issues. This in turn initiates many infections. There is a constant flow of unwitting carriers of pathogens roaming throughout the hospital and in the clinic settings on a daily basis. We cannot control the patient flow in the hospital. Therefore, we have to be diligent in our efforts to minimize the occurrence of nosocomial infections. The best action to take in the fight against these types of infections is simple hand washing. Refer to my visual aid. That is from the CDC Center of 2015. As you can see in the visual aid, hand hygiene is the number one preventive spread of infections. Once again, hand hygiene is the number one way to prevent the spread of infection. They also say hand hygiene saves lives. Nosocomial infections begin with the introduction of pathogens which spread throughout and on the body. Most hospital patients are at risk for acquiring an infection due to their compromised immune systems. It is very difficult for immunosuppressed patients to fight off infections. We have to do our part to keep our patients safe. The best way to keep infection from diffusing is to simply wash your hands before and after patient contact. Hand washing is a tool used to prevent disease transmission from the hospital worker to the patient. This is essential. However, the goal of compliance from the hospital staff is not being met. Hospital staff workers have become non-compliant and do not regularly practice good hand hygiene, and our patients suffer. Nosocomial infections remain an important cause of morbidity and mortality in the United States. According to the CDC control in 2010, my second point is that hand washing is an effective way to decrease nosocomial infections. An article in Infection Control Today 2000 states that there are different activities used to control and prevent the spread of infectious diseases. Whenever you control infection, it provides all patients with a safer environment. Therefore, hand washing is essential to prevent the spread of infection. Finally, the CDC 2015 discovered that hands must be washed before and after contact with infectious items. This is essential to remove all contaminants and germs from the hand surfaces. This is the first line of defense to minimize the chances of making yourself and your patients sick. It is easy to it will keep the risk of spreading infections to others low. Hand washing is easy and quick. It is such a small task to perform to ensure that we don't spread germs to our patients. Hospital staff and providers must have a greater understanding about the danger and damage these infections cause patients. Hospital administration should design more aggressive and detailed infection control policies. Hospital administration should provide more education to their staff. In conclusion, hand washing decreases nosocomial infection and decreases the mortality rate of hospitalized patients and the length of stay of hospitalized patients. Today, we have discussed hand washing will decrease the mortality rate of hospitalized patients, and the effective way to decrease nosocomial infections in the hospital is to perform effective hand washing. We as healthcare providers must become better patient advocates. We have a duty to protect our patients against acquiring any infections during their hospitalization. We must wash our hands properly and frequently to decrease infection. We have a duty to educate our patients on the importance of good hand hygiene. If we all work together to achieve this common goal, it will come to fruition. The common goal is to reduce the number of nosocomial infections in the hospital setting. In the healthcare setting, hand washing is the primary weapon for infection control. Many microorganisms can be reduced, and the amount of nosocomial infections will decrease greatly, thus decreasing the mortality rate and the length of hospitalization.